Hello and welcome to Yoma's live session with our expert. Today we have Dr. Neema Shrestha, who's a consultant pediatrician and neonatologist at Grande International Hospital. So let's just add Dr. Neema. Let me just add her. Hi, Dr. Neema, if you could just accept my request. So in the meantime, I'm gonna. Hi, Dr. Neema. Okay, there you are.
Hello.
Hi, how are you?
I'm good. Thank you.
Yeah, I'm good, thanks. So I'll just start with a quick introduction of you, and then we can get into the questions. We received a lot of questions in our inbox. So we'll alternate between the questions we received and the questions that we get live here. Okay. So Dr. Neema Shrestha is a consultant pediatrician and neonatologist at Grande International Hospital. And she has a special interest in the field of neonatology, which is newborn care. And she can elaborate more on what exactly neonatology means in a bit. And she works at the NICU unit at Grande International Hospital. So it's, so maybe Dr. Neema, if you can start talking about neonatology and how important it is. It's a very critical time, for premature babies, for babies who are born, that special care. So if you could start by just talking about neonatology, and then we'll go into the questions.
So basically, the branch of neonatology is a branch which deals with kids who are just born and generally up to the age of 28 days. So that is the neonatal period. But sometimes we do also do antenatal counseling for high-risk pregnancies in the antenatal period itself. So that is also where we come into the picture. And we also look after preterm babies that need specialized care in the NICU. And these babies do not generally just finish off after 28 days. Their term doesn't finish after 28 days, which is the neonatal period. So they do continue sometimes for months and months with multiple complications. So we do look after the babies in their infancy period also, which is up to the age of 1 year. And these babies do need regular follow-ups, regular checkups, even beyond the age of 1 year. So anytime from the beginning of the birth till whenever they need continuous care, we would be looking after these babies. So neonatology is basically just looking after babies in the NICU mainly, and handling the complications, making sure that the babies get discharged from the NICU with as little complications as possible and in a healthy way.
Okay, thank you so much for that explanation. Yeah, because a lot of people, when you have a newborn, we don't refer to. So yeah, so that's explanation. So yeah, we have a lot of questions that we received from like food on newborn, like bath and how COVID testing, different things. So with one of the biggest concerns of people is the moms and dads is the kids' weight. So we have a question here on my 11-week-old baby girl who's exclusively formula fed, weighs 6.5 kg. So the mom is concerned overweight. 11.
Just on the top of my head, I cannot actually say if a baby is actually overweight or not. Generally, what we do is when a baby comes into our OPD, we have to plot their weight, their height on a growth chart, which is specific for the age or the week that the baby is. So, and it also depends on what is the birth weight of the baby. But saying that, because I got the question beforehand, I know that the 11-week-old baby and being 6.5 kg is not overweight when plotted on the growth chart. Even if this baby was overweight, what we say is that babies are able to actually regulate their own hunger. So they know how hungry they are and they stop feeding once they're done. So just because a child is overweight does not mean you have to give them less milk to drink, especially during that first 3 to 4 months of life when their growth is actually the maximum, right? They also go through a growth spurt at around this around 3 to 4 months of age. If they do have an appetite wherein they do require that amount of milk, then decreasing the milk because the baby is overweight would not be a wise thing to do, because the baby is anyways going to get hungry and start getting fussy and demand more milk, and
Yeah.
will also take how much ever is required. So
Right.
for now, all they have to do is just feed the baby according to the baby's hunger cues. And once the baby is done, then they can stop feeding the baby. But saying that, keep following the growth chart at every visit to the pediatrician, and at different times see where the baby actually lies. Is the baby going way up on the growth chart? Then when the baby starts weaning, then we can actually go for more healthier options of food. But at the moment when the baby is just on milk, then it's not really required.
Okay. Okay. Thanks. You mentioned, yeah. So I don't think the person who asked the question has joined. Otherwise, we could have, asked the birth weight, and then, depending on that. But like by when, what is the, the criteria roughly? Like around what time does the birth weight double?
So generally, we expect the birth weight to double at about 5 months, and it
Okay.
triples by 1 year of age. But again, this is just a cutoff, right? So we cannot expect that all babies would double their weight by 5 months of age.
Mm-hmm.
In fact, these days, a lot of our patients in the OPD have already doubled their weight by 3 months, right?
Mm-hmm.
And but then because they're healthy, they're actually drinking milk, you do not have to really intervene much at this stage. So general cutoff is 5 months, double the weight, and triple the weight at 1 year of age.
Okay, so I'll move on to another question, which is also related to food. My baby girl, she's 23 months old, and she doesn't swallow her food even when she's hungry. And it's been going on for almost 2 months. So is this,
Okay.
concern? Um, what could it be?
Okay. Again, there could be multiple reasons why a baby just completely refuses food, right? So, firstly, did we change the way by which we are offering the food to the baby? As in, is the texture different? Was the baby on completely mashed foods beforehand, and now we're giving more chunkier bits, more textured food, and the baby is not really fond of the texture? Or are we giving some new food that is the taste is different for the baby, and the baby hasn't yet become accustomed to that taste, right? Also, are we seasoning the food enough for the baby? Because 23 months, the baby is expecting a lot of seasoned food in their diet. So, are we seasoning the food enough, or are we seasoning the food too much, right? And also other things like, is there teething issues? Is the baby going through a new teething phase where multiple, teeth are coming in at the same time, which the baby is not really, wanting to eat food? Saying that babies beyond 1 year of age usually have lesser appetite as compared to when they were prior to 1 year of age, right? So what we have seen is mothers generally assume that because the baby is growing in age, their appetite should also increase, right? But beyond 1 year of age, their appetite actually either remains the same or they start eating lesser than what they used to, because they do not need that much of calories
Right.
during the beyond 1 year of age. So it could just be that the baby is not really hungry, but they have been fed multiple snacks, let's say, right? So baby didn't eat a meal, so every hour the mother is offering something or the other, and the baby is always constantly half full. So
Mm-hmm.
when the meal time comes again, then again she doesn't want to eat because the stomach is already half full and she's more interested in eating, in playing or doing other things. So we have to take all those into factor and then see, what is the cause of why the baby is not eating. Or it could
Yeah.
just be that it's just a phase where the baby is not interested in food. So we
Mm-hmm.
keep trying to give food in a way that the baby was accepting and not make any changes at the moment,
Mm-hmm.
and just keep persistently trying.
Yeah.
That's it.
Okay. Thank you. So we have a few questions related to newborn babies' bath time. So how often should we give a bath to a newborn baby?
Oh. So a newborn baby usually do not require bathing as such. So when the baby is generally for the first 24 hours of life, we do not do anything to the baby because we do not want the baby to lose heat from the body. Beyond 24 hours, we can just do a complete sponging of the baby. And even after the baby has gone home, what we suggest is to not give a complete submerged bath, like put the baby completely in water
Yeah.
until and unless the cord has not fallen off, because we want the cord dry to prevent any infection setting in. So until the cord falls off, just sponging the baby on a daily basis is going to be enough. And once the cord has fallen off and the cord is dry, there's no infection at that site, you can go on for regular baths for the baby. And saying that, we do not need to follow the whole, baby should be given a bath only once a week or once in 10 days. You can bathe the baby every day if you want, right? Be it winter, be it summer, a daily bath is okay for the baby. The only thing is we do not want to use a lot of harsh soaps or anything that can actually get rid of the outer layer of the skin oils, so we want the skin oils to be intact. And so if you're going to give a bath every day, then use very mild baby soap, or just a simple water bath is going to be enough, and a soap bath twice a week should be adequate. So there's no set rules, but
Yeah.
you can do whatever suits you best.
Yeah. As long as it's like not harsh, the soap. So we have
Yes.
a similar question just on the live earlier. Why should we not use powder, talcum powder on a baby?
Okay.
So that
So
so the person is assuming we should not use it. Should we use it or
yes.
not? Why should we? If not?
Yes, so we advise that the baby not be used, not be given any powder on any surface of the baby for a few reasons. Firstly, we had the whole controversy about talcum being carcinogenic, and one of the very famous brands was actually sued for millions and millions of dollars. So if you do not know what your powder contains, then it's going to be harmful to the baby. Maybe not now, but in the future. Secondly, because the powder is so fine and you apply it, it's basically just dust, right? So the baby can actually inhale it, right? And these fine particles of powder can actually get inhaled into the lungs and can cause chemical pneumonitis, right? Thirdly, this is what I say to most of my patients. What they do is the baby has a rash somewhere, a diaper rash. What they use frequently is powder. So what happens is the sweat, and if it's in the diaper area, the urine, the stool, everything is just going to mix with your powder and it's going to form a paste. And that paste is going to be even cause more friction against the baby's soft skin and cause small micro lesions which can actually bleed. It can actually cause injury to the skin of the baby, the soft skin. So that is why powders are actually not advised at all for babies.
Okay, that's the reason. So you mentioned rashes. So we have a question here: how to treat heat rashes on the face?
Okay. Firstly, please do not put the baby in the sun for prolonged periods of time. Just 15 to 20 minutes of sun exposure before around 9 o'clock, because even after 9 o'clock, we have very harsh sun rays these days. So before 9 o'clock, 15 to 20 minutes of sun exposure should be enough, whether you're doing it for jaundice purposes or to get vitamin D for the baby, that should be adequate. So beyond that, do not expose this baby to extreme sun rays. Secondly, do not apply oil when there are already rashes on the face, right? So because the oil is just going to clog all the pores and it's going to just worsen. And make sure that you do wipe down the baby or sponge the baby or give the baby a bath if the baby is having a lot of heat rash. Do not put too many clothing on the baby when the baby is having a lot of heat rash. Keep the baby cool in very mild, light clothing, and avoid oil. That's it. and avoid sun.
Okay. Yeah. Hope that was helpful. So we have a question on COVID related. So after testing negative for COVID, can I take my 7-month-old baby for their second flu vaccine, or should I wait?
Okay. So is this the baby who is negative, or the mother has, I'm guessing the mother has tested negative,
Yeah.
right? So if the mother has tested negative and the baby was completely asymptomatic, had tested negative, there is no issues. You can take the baby to the vaccine. You do not need to wait any further.
Mhm. Okay. Thanks. Yeah. I mean, it's a question we got in our inbox, so we don't know. Otherwise, we ask follow up questions. So also another question is related to this allergic. There are certain questions related to different conditions. So one is related to allergic rhinitis. If you could talk more about it, what causes it, and what remedies would you suggest to a 3-year-old, 3.5-year-old who has allergic rhinitis?
Okay. So allergic rhinitis is basically there is a genetic component to it. There must be somebody in the family who's got histories of allergies or histories of sneezing. Even if they were not diagnosed with allergic rhinitis, there must be somebody in the family who would get up in the morning and just continuously sneeze
Mm-hmm.
for the better half of the mornings and then become normal, or have constant running nose, right? So there is a genetic factor that plays. Otherwise, it could just be allergies that
Mm-hmm.
happen over and over again, right? So the first thing that you have to do in this is control exposure to certain things like dust mites. We have carpets that are rarely vacuumed, or dust that settles because of all the construction that's going around our house, or maybe there is certain food items that the babies shows an allergy to. It could be just bananas, it could be chocolate, anything that they've noticed that the baby eats and suddenly has some symptoms of allergies. So
Mm-hmm.
in such cases, hold on to the food items, do not give it to the baby, or try to restrict exposure to these allergens. Then
Mm-hmm.
comes the medication, right? So for the medication, they will have to see an ENT specialist itself, because at our point, what we give generally is a simple nasal spray or a light nasal steroid sprays, right? But beyond this, if it's not helping and the baby continues to have symptoms, they will need to have a visit with the ENT specialist to go on for further treatment.
Okay.
But at the home, yeah, from the home point of view, they need to control the allergen exposure that can happen at home. That's it.
Mm-hmm. Okay. Okay. Thank you. Thank you, Dr. Neema. So this is related to, we have questions related to breastfeeding. Do we need to wash nipples before and after breastfeeding?
Not necessarily at each feed. What we want is that the mother at least takes a bath at least once a day, or if they're not taking a bath on a daily basis, then they should wipe down their breast at least once a day before the first feed. And then throughout the day, they can just continue feeding without any wiping. And even after
Mm-hmm.
breastfeeding, they do not need to wipe down the nipples or the breast region.
Okay. So another question is also related to breastfeeding. How do we pump and store breast milk, and and for how many days can breast milk be stored in the fridge?
Okay. So there are two main methods by which we can pump our breast milk. First is by hand expression, right? So we want to make sure that when, suppose this is our breast, right? And this is the nipple area. What we want is that the breast is massaged all the way from the top, right? And then just around the nipple, the areola, which is the black part, we want to squeeze at that region and not just at the nipple area, because squeezing the nipple will not get any milk, right? So we want to massage the breast from all areas and then squeeze around the areola to get the milk, and the milk should be collected in a sterile container. Another way is by using a breast pump. And breast pumps also, there are manual breast pumps and electric breast pumps. So whichever is feasible can be brought. And the milk, once it's collected, if left in room temperature, can be stored for up to 2 hours, as long as it's kept in a place that does not have direct sunlight, and is covered properly with no contamination, can be kept in room temperature for 2 hours, and within the 2 hours can be used. If we are collecting the milk to be used for a later purpose, then we can keep it in the fridge, right? The refrigerator. Do not place the fridge in the door of the refrigerator. We want it to be preferably above the vegetable basket, towards the back, so that even if the fridge has been opened multiple times during the day, it does not affect the temperature too much. And if you're collecting on every breastfeeding time, then we want it collected in a separate bottle at all times and then placed in the fridge. And once it has cooled down, like in an hour or so, then it can be mixed with the previous collected milk. But it should, the timing that is actually taken would be the timing that the first milk was collected, right? So if you have collected milk at 9 o'clock and then the next milk collection was at 1 o'clock, and we mix the milk together after both have been chilled, then it will count as collected at 9 a.m., right? So that is how you can collect. And if it has been collected and placed in the fridge, then we can keep it for 4 days, up to 96 hours, right? So, but then the earlier we use it, the better it is, because there is slight loss of nutrients. Collect it, I can place it in the fridge for 4 days. If we have a lot of milk production and you want to freeze the milk, we have special bags, breast milk storage bags that are available nowadays, even in Nepal, very easily. So in that, we can place it in our freezer section for 3 to 6 months. And then thaw it before using it for 24 hours and can be given to the baby after rewarming of the milk.
Okay. Yeah, thank you, Dr. Neema. And I'd also like to add, if like if you want to know more, you do get a lot of products related to breast milk storage here. So we actually have an article on Yoma also on essentials on breast milk storage and where you get it also. So we have, where you breast storage bags and breast pumps, and there's also the silicone latch-on pump, which when you're feeding from one breast, you can add pump on the other breast too, because there is a milk let down right from the other breast. So take that milk. So you can check out that article as well.
Yes, that's called a haka actually, and it's really easy to use, and it's very beneficial to not let that milk go to waste.
Yeah, I also used it for my second baby. So I didn't know about it for my first, but then for the second, it was a lifesaver. Yeah, I really recommend the haka. Yeah. So a question on they would like to know more about startle reflexes and whether or not that's normal.
Okay. Startle reflexes are generally normal in a newborn period up to maybe around 4 to 5 months of age, especially in the presence of loud noises, sudden loud noises or intense lights, or sometimes even we have it when we're sleeping, we have that sudden sensation of falling and we get up all of a sudden. So if that same thing happens to the baby also, they can startle in their sleep. But if it continues for very long periods of time, or if there is an exaggerated startle reflex that is occurring very frequently during the day, then that could be a sign that there is some underlying neurological problem. That needs to be checked out. So because startle reflexes are normal, there are certain things that we can do to actually calm the baby. Hold the baby very close to you during the startle reflex while putting the baby down to sleep or carrying the baby. Make sure that the neck region of the baby is supported well. And swaddling will also help to reduce the number of startles in a baby.
Yeah. Okay. So they want to be in that closed, it's a new environment for them. So safe and
like they still want to feel that they're in the womb and secure. Yeah.
Okay, so we have a question on lactation. So if you lactate well for the first baby, can we assume that we will lactate well for the second as well? Or is there a possibility that they won't lactate too well as much as the first time?
Our body is made in such a way that if we are pregnant and we are delivering a baby, we will be making milk for that baby, right? But there are many factors that could actually cause a mother to either overproduce milk or underproduce milk, right? One of that is stress. So it doesn't mean that if you lactate well for the first, you won't lactate for the second, or you will lactate for the second also just because you lactated for the first. It all depends on how frequently you feed your baby, how calm you are, and how well your attachment is, right? So you have milk, but the baby is not sucking well, and you're not emptying your breast efficiently. Your milk supply will decrease because the body assumes that the baby is not needing that much of milk, right? So it just starts to produce less milk. But if you think that the baby is not attaching well or sucking well, then and you pump that milk after the baby has fed, but the body will still continue to produce the milk, right? So both pregnancies are going to be completely different from each other. Both lactation periods are going to be completely different, but yes, the body is going to be equipped to be making milk at every pregnancy. So we do not need to really worry about that. We do not need to stress about it. Just give our best for the breastfeeding.
Yeah, I think less stress is key, right?
Yes.
Less you have, I mean,
Yes. A healthy mind, a happy mind is a happy body.
yeah, definitely. So we have another question on a particular, you know, condition of umbilical hernia. What causes umbilical hernia? And do you have suggestions for parents about this?
Okay. A few babies after birth, basically the umbilical hernia is seen at the place from where the umbilical cord comes, which is attached to the placenta and to the mother. The baby is attached to the mother through that umbilical cord. So sometimes after birth, the ring structure that is there through which the cord comes, or the cord once the cord has fallen off, it doesn't close completely, right? So there's a small opening through which then the contents from the abdomen can come out, right? So this could be normal for a lot of babies. We do not need to do anything. We have the whole myth about tying a coin and taping, like wrapping cloth around the abdomen so that it doesn't swell up. So none of that is required. Usually, for most babies, that closes on its own. What we need to see is the size becoming smaller and smaller, right? The pediatrician can also check that during the well baby visits. And what we need to keep in mind, being at home, is there a swelling that is not being reduced, right? Or is there a swelling that is getting discolored, right? That is an emergency, and we need to go to the hospital immediately, be it the middle of the day, middle of the night. You need to get that checked. But if it's a swelling that when the baby cries, there's a swelling, and then once the baby settles down, it reduces on its own, we do not need to worry about it. The doctor will give you a timeline as to till when we can actually wait and see without doing any intervention. And they will tell you when an intervention is required.
Thank you. So another question is related to my baby's back of the head is always hot and sweaty, whereas the rest of the body is cool.
Okay. So baby's head is the area which has the most surface area, right? So a lot of heat losses would be through that area also. So it's a normal thing, because especially also because the baby, especially if it's a small baby, they're in a position where they're not moving much. They're always lying down on the head, and that is the part of the head that is actually being in contact with the surface of the bed, right? So the head is already warm, and because that is in contact and it's not moving too much, it's going to be hotter than the other part, right? So for a baby sweating, a baby being a little hot on the head but is active, normal, we do not really need to worry. A sweating baby is also normal, especially during the summer seasons, and we do not really need to worry. We just need to make sure that the baby's clothes are changed regularly. If the baby continues to sweat in such a way that the entire clothing is getting wet.
Okay. Okay, thanks. So I'll alternate between a few questions we received just now as well. So are additional vaccines available at Grande, like, for example, chickenpox?
Yes, we do have all vaccines available at Grande. Hepatitis A is not available right now, and I think it's not available in most hospitals in our country because we're not getting it yet. So other vaccines are available. We had a few issues when there was a lockdown due to the um, transportation. And currently, we do not have the influenza, the new strain of influenza that is also on the way, but all vaccines are generally available. If you want to book a vaccine, it's preferable that you call beforehand and see which vaccine is, because sometimes it could just be that the transportation has not arrived from India or from wherever it has to come, and the vaccine's not currently available, but on a general basis, they are available.
Okay, and why is it that the hepatitis A is not available? Is it due to transport or?
Uh, that we've asked the medical representatives, and they said that their licensing has not been renewed, and they've not been able to get it yet. So I think most of the hospitals are facing a shortage on the hepatitis A vaccine.
Okay. Okay, so something to be aware of for the moms.
Yes.
You know, if they need that. Okay. So do the doctors give us the APGAR score as soon as the baby is born?
No, not really. The APGAR score is written on the neonatal sheet, but and it will be available at the discharge paper, right? But unless the baby has undergone some, let's say, injury, hypoxic injury at the time of birth, we usually do not tell the parents the APGAR score if it's a normal score. So,
Okay. What is the normal range, if you could elaborate on that?
it's basically APGAR is where we see we give points to the baby, 1 point each to the baby, sorry, 2 points each to the baby on 5 different things like the appearance and is the baby pink or blue, or is the baby moving all the limbs, or is it the baby limp? How is the cry of the baby? Is the respiration good or not? What is the pulse or the heart rate of the baby, right? So the baby is graded on this at 1 minute and at 5 minutes, right? So this is basically how basically this is going to tell us a low APGAR score at 5 minutes is going to tell us that the baby came out in a state of hypoxia. And a low APGAR at 5 minutes would say that even with intervention, the baby was not able to actually get resuscitated well enough, right? So there could have been a hypoxic injury that occurred while the baby was in the mother's stomach, or soon after coming out, there could have been a hypoxic injury, and the resuscitation was not enough to actually make the baby normal, right? So preterm babies may have a very low APGAR score just because they are preterm and needed to be intubated immediately. So the APGAR score is generally, debatable, because while we are working, we do not really, outside in the West, we have a nurse standing by and, jotting everything. Here, because we are working, we go rhetorically and be like, oh, at 1 minute the baby had this. So it does not correlate too much, right? But then a very low APGAR score could be something that detects that the baby had some form of a brain injury.
Okay, thank you, Dr. Neema. So another question is a mustard pillow a myth, or does it really help shape the head of the baby?
Okay, I guess there are no researches done on that, or I have not come across it. But mustard pillows have been helping us shape the size of the shape of the baby's head since, I know, time immemorable. So the thing is, even with the mustard pillow, what we do is we put the baby on the side, and then after one feed, put the baby on the other side, which is actually not what safe sleep suggest, right? According to the Safe Sleep Study, the babies have to be placed only on their back at all times. So even with a mustard pillow, if a baby is sleeping just on the back, it's not going to help shape the head, right? And we do have, I think every house has mustard pillows being used for babies, but we still get babies with misshapen heads, right? So it could be helpful to some, but I don't think it's a must. Since there's no harm, we can still continue using it.
Yeah. Yeah. Okay. Because it's, I mean, it's soft, you know, it takes the
Yes.
baby's head. So,
Yes.
so
I know a lot of adults also wish they could sleep on that mustard pillow for themselves.
yeah, that does seem cool. So another question that we received in our inbox prior to the session is, what are the reasons for SIDS, sudden infant death syndrome, and what are ways to mitigate them?
Okay, so sometimes we do not know what causes SIDS. We could just put a baby down to sleep, and then when we come back, the baby is not breathing, right? So there are certain things that can be a risk factor for SIDS, such as covering the baby's face, putting the baby to sleep on the side, or putting the baby to sleep in a crib that has loose ends, loose bed sheets, or a lot of soft toys around. So these are all risk factors that can increase the incidence of SIDS. So there are a few things that are suggested to prevent SIDS. Firstly is, like I said, put the baby to sleep always on the back. Secondly, put the baby to sleep in a separate place, right? As a community, we are very pro co-sleeping, but one of the reasons for SIDS has been found to be co-sleeping. They say put the baby to sleep in the same room, but not on the same bed, right? So that could also be a reason. Like I said, a lot of toys around the baby while sleeping, a lot of loose sheets. We never put a baby to sleep without the blanket, right? But the blanket would actually cover the baby's face and asphyxiate them, right? So all these loose beddings and these could all increase it. So put a baby to sleep on a crib without anything, place them in a sleep sack, or sleep sacks are not so common in our community. So what we can do is make sure that the baby is completely clothed well, right? So even if they sleep without a blanket, it's okay. Right? We think it's cute to put soft toys on the next to the baby while sleeping. Do not do that, right? They have said that pacifiers, although they don't know the reason, pacifiers have been found to be helpful against SIDS. So maybe try that also for a while. So practicing safe sleep practices will decrease the incidence of SIDS considerably in a baby.
Yeah. Yeah, thank you, Dr. Neema. So we have another question, which is, my baby is 30 weeks old. She's cleared for heart murmur and other related checkups. Do we need to read?
Sorry, I didn't get the question. Can we repeat the question?
The question is about a baby who's 30 weeks old and she's cleared for heart murmur.
Okay.
Whether or not a retest needs to be done related to the heart murmur.
Okay. I think the question is a little incomplete, as in, like, why was a heart murmur tested? Did the baby have something in the beginning? And was an echo done or not to rule out any heart conditions, right? Or is it in a country where a heart, checking for heart murmurs is a common practice, right?
Yeah.
So if the baby did have some condition which could lead to, point towards a heart diagnosis, a heart condition diagnosis, then probably an echo needs to be done to actually rule out any structural defects. Or did they have any cyanosis, that is bluish discoloration of the lips, which could also point towards a heart condition. So if we are thinking of a heart condition, then I think an echo is needed before ruling out any heart issues. Or if it's just a simple routine checkup that they've gone for and there've been no heart murmur detected, then we do not need to do anything more.
Okay. Okay, thanks. We have another question which is related. It's baby was born with a hole in the heart, and they say that it hears, it gets fixed on its own. And
Okay.
when it was done at 6 months, the hole in the heart was still there.
Okay.
So, at what intervals should tests be done, or echo
Okay.
should be done?
So, generally, if this is the one where they say that the heart, the hole in the heart is going to get better by itself or get fixed by itself, means that it's a condition that is not going to cause too much of an issue. And with the growth of the child, the hole in the heart will also start to close by itself, right? So, in such cases, we can wait, we generally wait till 2 years of age, unless the baby starts to show symptoms such as poor weight gain or very frequent respiratory illnesses. All right. So if these are or baby is not able to eat well at all, right, despite having a good appetite. So if these are the issues, then they might need more frequent checkups and may need to be on medication to decrease the load on the heart. But if the baby is doing well, then a 6 monthly or if they've done one at just 6 months, then maybe a year later should also be fine.
Okay. Okay, thanks. Actually, the same person asked another question also, which is the baby sneezes a lot at night and in the morning as soon as they wake up. So there's a lot of sneezing. So,
Okay.
but
Um,
a lot of
Again, like
runny.
I said for allergic, what I said for allergic rhinitis is the baby being exposed to a lot of dust, right? Is the baby sleeping in an area where there's a lot of cold draft coming towards the baby, right? So look at
Yeah.
these issues. Are there dust mites or just dust collections? Or is the baby sleeping with a lot of soft toys which can have the dust collections in them? So look for exposures to dust and exposures to allergens, like cold could be an exposure, and keep the baby away from it, or and try to see the cause. Basically, try to find the cause which is causing that. Or is there an allergy history in the family that could be causing just the sneezing in the mornings, but is fine the rest of the day, right?
Yeah.
So try to find an allergen and try to see for the family history of allergies.
Okay. Thank you. So another question that we received in the live session is my 15-month-old baby doesn't drink animal milk, curd, or cheese, and breastfeeds very less. So she has milk only before sleep. Should I be concerned about the level? She
Okay.
only has night before sleep, so of a 15-month-old. So should
Okay.
I be?
So, a common misconception is that only milk or dairy products give us calcium, right? There are a lot of food items also that can be a source of calcium for the baby. So, if the baby is not taking any dairy products, what we can do is firstly add that dairy product to the food, right? Don't give milk as milk, right? Add it in their oats, add it in their bakery products, or make paneer, or make cheese with as fries, or something like that,
Yeah.
and or as a topping, just as a topping on bread. So try to inculcate dairy products in that way. If they do not take that, then we go for other sources also of calcium, right? Like
Yeah.
sweet potato or broccoli, or figs are a good source of calcium. So try to find food items that have calcium in them and try to give that if the baby is not taking. We do not necessarily need to go for supplementation if the baby is taking other food items also in a adequate manner. But
Yeah.
we can get tested if you really think that the baby is not having a good diet and is not taking milk or milk products also, then get tested, see the calcium level, and then you can supplement for a short period of time.
Okay. Okay. Definitely better to just check if we're unsure.
Yes.
So we also have a question on people would like to know about your timings at Grande. What days and hours there?
Okay. So I'm available every day from Sunday to Friday between 9 to 5 p.m.
Okay. Okay. Sunday to
Friday.
Monday. Yeah.
Sunday to Friday.
Sorry. I need to write. Okay. If you could also elaborate on how common is premature baby? How common is is it to have a premature baby, and what are the signs that a mom should be aware of, prior
Okay.
to?
So I think recent times, I do not have an exact number as such right now, but in recent times with the advent of IVFs and in vitros and all, premature babies are a little more common as compared to before. But also because we have better medical facilities compared to, let's say, even 15 to 20 years prior, right? So a lot of premature babies are being saved because we have the facility for it. So premature babies are quite common these days. Uh, and basically, what we need to know, I think, um, better. I think a gynecologist would be a better person. But what I can say is that if you think that the baby is not moving too much, right, or if you feel that there's some form of bleeding that's happening, or if you've already had a baby prior who was a preterm baby, if you are a hypertensive mother, or you have any other, let's say, medical illness that could cause prematurity, right? Or if you fall ill during the pregnancy, which could lead to premature labor, then you have to be careful, go for a checkup, take adequate rest, right? And just be in constant touch with your gynecologist to know when do you need to actually come in to see, and what is the right time to actually take an intervention, basically. So, and I think talking to a gynecologist would be the best option rather
Yeah,
than me.
this
Yes,
called a gynecologist for this. So in terms
yes.
of, you specialize in neonatology and NICU. So not all hospitals in Nepal, in Kathmandu, I mean, do have neonatal units, right? Like I believe MedCity has one, Grande has one. Are there other hospitals which have neonatal units? And what do,
Yes.
in the case of children who are born in a hospital without a neonatal unit, and if they do need that NICU care?
Okay. So in Kathmandu, we have quite a lot of hospitals with NICU. Like even Norvik has an NICU. Most of our medical colleges, like Kathmandu Medical College, Nepal Medical College, Dhulikhel Hospital, all of these have NICUs, right? And a lot of the places outside Kathmandu also have NICUs, but they may not have a level 3 NICU. That is the one which has all facilities for managing a preterm neonate, or a sick neonate, let's say. So in such cases, if it's going to be a neonate who just need like a short stay, then they could be in a level 2 NICU also. But I think the doctors would inform them beforehand if the baby is getting more severe or more sick and needs an upgrade to a higher center. And cases where we know beforehand, before delivery, in cases where we know that the baby will be requiring an NICU at the time of birth itself, it is always preferable to shift the mother itself to the higher center for delivery rather than delivering and then shifting the baby. But in case the baby is delivered in a place where there is no NICU setup and needs an ICU, then the doctors would do the necessary resuscitation, stabilize the baby, and then find a hospital where an NICU bed is available, and then transport the baby with experienced person to handle the baby on the way.
Okay. Okay. Yeah, thank you. That's very good information for everyone to know and be aware. And so another question is, my 16 days old newborn poops frequently and their stool is mustard colored and liquid. Is that normal?
Okay. So generally, babies who are during the neonatal period usually have a semi-solid kind of a stool and is golden yellow in color. So I think the color variation, mustard color, golden yellow would be similar, but the liquid part, is it too watery, right? So sometimes what happens is we're just giving a lot of fore milk to the baby, and then the baby passes slightly watery stools, right? It could just be that. Or if it's the same type of stool that's happening every day, but the baby is in a good weight-wise, the baby is gaining weight properly, is active, and has no other issues, then we do not really need to worry. So, but unless the baby is crying while passing stools, or there are flakes of blood that is being seen in the stools, or it's like large volume stools that are very foul smelling, then maybe get the stool tested, get it seen by a pediatrician before going any further.
Yeah. Yeah. I think if you could even elaborate on, I mean, fore milk and hind milk, right? Fore milk is the milk that comes initially, and as you keep
In the
feeding,
initial
then
period.
hind milk is the more, the more filling milk, right? So
The
I
more,
think
yes.
it,
So the
elaborate.
fore milk is the one basically that gets, the takes care of the thirst part, whereas the fore milk is the one that takes care of the hunger part in layman's terms, if you say, right? So the baby should be getting both adequately for a normal or a good growth.
Yeah. So you need to, basically, when you feed a baby, you need to empty the breast, right? So that they get
Yes,
more
before
milk,
moving on to the next breast.
for the, to, quench the hunger. Yeah.
Yes. So generally, most babies, if they feed anywhere between 10 to 20 minutes, they are getting adequate amounts of fore milk and the hind milk.
Yeah.
But saying that, some babies completely empty the breast even within 5 to 10 minutes, right? It depends on how voraciously the baby is feeding. So
Yeah.
I think once the parents start feeding, once the mother starts feeding, she gets an idea about whether the baby is full or not. So if the baby is full and the breast feels emptier, no matter what time the baby has been feeding for, the baby is getting good amount of milk.
Yeah. Okay. Thank you. So we have another question on a breastfeeding mom. So I'm a breastfeeding mom, and I've been giving formula to my 3 week old baby. How do I know if his stomach is full?
Um, okay. So, firstly, is she supplementing the formula because the baby is hungry despite breastfeeding from both sides? Firstly, we need to know that.
Yeah.
Then, to know that a baby is full, firstly, the baby will be sleeping well after feeds, right? The baby lets go of the breast by themselves, and no matter how hard we try to feed the baby at the same time, they will not accept the breast for feeding. Baby has a good amount of wet diapers, that is about 6 to 8 wet diapers in a 24-hour period. And between two doctor's visits, the baby's weight gain is good, right? So adequate for the age, then we know that the baby is feeling well. So a baby who's not getting adequate milk would be crying even after the breast has been emptied, wakes up within half an hour, again hungry for food, right? So, and is passing less urine, right? Does not have as many wet diapers as they should be having. So these are signs that we can go by to know whether the baby is actually feeding well or not.
Okay. Okay, thanks. I hope that answered your question. So we have just a few minutes left, and we have one other question, one last question, which is how are children fed in the NICU? Is it formula? Is it given through a bottle or a spoon?
So we would always prefer breast milk, right? But sometimes what happens is with the cesarean section, the mother will not be able to come to the NICU to feed the baby, or the baby may sometimes be so sick that the baby is not able to take milk directly, right? So we have multiple methods. If the mother's milk has not come in and the baby is fine feeding wise, does not require feedings to be feeds to be held, then we sometimes, after taking permission from the parents, give formula. But saying that, we always advise the parents to start expressing the milk, and even if it is just like 1 ml, 2 ml, to send it to the NICU so that we can give it to the baby at the earliest, and to do this every 3 to 4 hours. And if you have a mother who is able to walk, like she's undergone a normal delivery, she can come to the NICU, and the baby is there for other reasons but can be fed. Then we put the baby onto the mother's breast as soon as the mother is ready.
Yeah.
Some babies who are preterm and cannot be fed directly via the breast or via a cup. In such babies, we need to put a feeding pipe through either the nose or the mouth that goes directly into the stomach. And if, for these babies, we generally always prefer mother's milk to prevent stomach infections. So I ask the mother to express the milk, and then the milk is then given to the baby via that tube, which is kept through the nose or the mouth. And this is again, the milk is sent by the mother every 2 to 3 hours whenever the feeding is required. During that time, the mother can come to the NICU, and if the baby is stable enough, then the mother can do skin to skin contact so that the milk production is helped and the baby and the mother have a bonding. So those are the ways of feeding the baby in the NICU.
Okay, thank you so much, Dr. Neema. We will also receive comments in our comments. People are commenting that it's been very useful, very informative. So thank you so much to all our viewers for asking the questions, for participating, and especially to Dr. Neema for providing insights on questions that most moms have on breastfeeding, feeding, weight gain. I think we covered a lot of things, and especially it's breastfeeding week as well at the moment.
Yes,
so
it is.
Yeah, we actually 4 articles related to breastfeeding also, written by a childbirth educator. We have someone who what they did with regard to breastfeeding during COVID when they contacted COVID, and also on starting like weaning off and starting solids. So do check them out on Yoma as well. And thank you so much, Dr. Neema. This has been very helpful, and thank you to all our viewers.
Thank you for inviting me to talk on such an important topic. And I hope the mothers have gained some or the other information that they really wanted. And if they want more information, they can contact me either through Yoma or directly. I will be happy to help anytime.
Yeah, Dr.
Thank you so much.
Sunday to Friday, right? 9 to 5.
Yes, Sunday to Friday, 9 to 5 at Grande.
Okay, yes. Thank you. Okay.
Okay. Thank you. Bye.